Today we hope to teach you a bit about urinary incontinence. Let's join the conversation between Emily and Michelle. Hi Emily, how have you been? What's new?
I'm so glad you asked. There is something, and I'm so embarrassed I don't even know who to tell. I was running on the treadmill and all of a sudden I had peed on myself. It was awful. I had to leave the gym and go straight home.
Oh no! Something very similar happened to me a few times. I was driving to work and suddenly got the urge to go to the bathroom. I thought I was going to make it, but as soon as I stepped out of the car, I leaked urine all over myself. I was soaked and embarrassed and had to go back home that day. Ever since then, I've started keeping an extra set of clothes in my car.
That sounds much worse than my problem. What are you going to do?
Honestly, that wasn't the only time it happened to me. It was just the worst. I was so frustrated with everything that I had to mention it to my OBGYN. I was desperate and willing to do anything. She referred me to a doctor who specializes in bladder problems, but even that made me nervous to talk to someone else about these private issues. I wasn't going to go until I talked to one of the other moms at school. She said the specialist made her feel very comfortable, and it sounds like she had a problem similar to you, and she had surgery done, and she feels so much better. She convinced me to go, and I'm glad I did.
What did they do for you? Did you have surgery? Tell me more.
Well, it turns out that there are two main types of leakage with two different treatment plans. The type I have doesn't require surgery. They told me one of the things I should do is cut down on my coffee, soda, and other bladder irritants. She also recommended a medication that I take every day, and I feel so much better now.
Oh, you'll have to give me the information for that doctor. I'm definitely going to go.
Hi, Emily. I'm Dr. Nora Lee. Why don't you tell me what brought you in to see me?
Well, I was talking to my friend about how I leaked urine on myself when I was running. She suggested that I come and talk to you.
That is a very common complaint, and I hear stories like that from women every day. In fact, almost half of all adult women have some sort of leakage, and a lot of them come to see my colleagues and me. Please tell me a little bit more about how long this has been going on and what kind of things make you have urinary leakage.
Well, I noticed it after I delivered my second baby. No matter how many Kegels I do, I keep leaking. It's happening more often and I'm leaking more urine. Besides that time at the gym, I've also leaked on myself when I tried jumping on the trampoline with my kids and a few other times. I don't even like going to the gym anymore, and I feel like I can't be active like I used to be. I'm worried someone will notice.
I'm so sorry that has happened to you. I think we will be able to help you here. It sounds like you have something we call stress urinary incontinence. Urinary incontinence is the involuntary loss of urine. There are three major kinds: stress, urgency, and mixed urinary incontinence. There are modifiable as well as non-modifiable risk factors, including age, the number of deliveries you've had, how you delivered, and obesity. Additionally, what you eat and drink, if you smoke, and where you work can impact your incontinence. For example, some jobs can impact how often someone can attempt to void. Urinary incontinence can have a significant impact on quality of life. Women who have leakage can have feelings of depression, anxiety, as well as skin irritation and infections. They can also have avoidance of sexual activity, fear of leaking in social situations, and social isolation because of this. Besides that, the cost of products is very expensive, and there is a burden on caregivers. Often, women find themselves bathroom mapping or looking for the closest bathroom each time they leave their house. Your doctor may decide to do some testing as part of your evaluation, including urine testing, an ultrasound to check how much urine is left in the bladder testing to get information about how the bladder works, a bladder diary, and a physical exam to check for prolapse. Well, Emily, your exam and test confirmed what I mentioned earlier. You have something called stress urinary incontinence. There's a couple different ways to treat that. Let's talk about how we can make this better. Before we can talk about what to do, we should talk about why this happens to women. Sometimes sudden pressure caused by activity or stress unintentionally pushes urine through the urethra, the tube that carries urine out of the body. Women have leakage with laughing, coughing, sneezing, and jumping, and other such activities. This happens to 1 in 3 women over the age of 45. There are both surgical and non-surgical ways to treat stress incontinence. Non-surgical methods include lifestyle changes, pelvic floor physical therapy, and a pessary. Surgical treatments include a mid-urethral sling, urethral bulking, or a urethral suspension. Well, Emily, it's been 6 weeks since your surgery. How do you feel?
I feel amazing. I haven't had any leakage at all, and I've barely had any pain. I barely used any ibuprofen, and I didn't even fill the prescription for the other pain pills you gave me. And I have to tell you, I cannot wait to get back to the gym.
I'm so happy to hear that. Let's do an exam and I can clear you to get back to all of your normal activities.
Sounds good. And Michelle told me to tell you that she's feeling great. She's happy with the medication, and after your talk, she's really cut down on coffee.
I'm so happy to hear that both of you are doing well. Before getting surgery, you should talk to your doctor about potential risks of the procedure, including bleeding, inability to empty your bladder temporarily, mesh erosion, or pelvic pain. Despite what you may have heard, the FDA has said that the mid-urethral sling is a safe and effective treatment for stress incontinence. It's the most studied treatment for incontinence in history and is the standard of care. Doctors who can provide this treatment are called urogynecologists or female pelvic medicine and reconstructive surgery specialists. You can find more information at our website, voicesforpfd.org. Here you can find information on pelvic floor disorders and find a provider close to you. The website has several fact sheets on a variety of medical issues, including stress incontinence, and the treatment options for it. Thank you for watching this video. You can always find more information on our websites, augs.org and voicesforpfd.org.